Hey there, everybody. My name is Dr. Allison Lois. I'm a physical therapist who specializes in working with dancers. I am on here tonight to talk about pre-pointe screenings, why they're important, what information they can give you, and how we can use them to benefit your dancer, or if you are the dancer, to benefit you best. And then also to talk a little bit about the Pre-Pointe Bootcamp class that I'm running this summer. So again, my name is Allison Lois. I'm a doctor of physical therapy, specializing in working with dancers. I went to Hope College and got my exercise science degree there, along with a minor in dance. I also worked with a pre-professional company while I was at Hope, so did a lot of dancing there. Went on to massage therapy school, where I earned my certification and got my license. And then I went on to PT school at Central Michigan University, graduating in 2017, and I've been working in the outpatient orthopedic space ever since then. So I love working with dancers. I absolutely love what I do as a physical therapist. And I think dancers are a really special population because they work so hard. And we've always known that dancers work so hard, but the science is there to back it up. It's a growing field of scientific research, and we're learning so much more year after year about the special considerations for dancers. So what I hope, I'm going to take a look at my notes here. My mission as a physical therapist, when it comes to treating dancers especially, is to empower dancers to move with joy and confidence, and to provide science-backed care that nurtures longevity and love of movement. So that is my number one goal anytime I'm working with dancers, anybody in the world that I'm working with, but dancers especially. My goals for today's talk: I want to make sure that you understand what point readiness means. It's more than just your age. It's not the Hogwarts letter at age 11, you get to go. There's more to it than that. What to do if maybe your dancer isn't ready yet for pointe, and how the pre-pointe screening and pre-pointe boot camp can help if maybe your dancer isn't ready, or if your dancer just wants to get stronger. So the pointe readiness screening, or the pre-pointe screening, is a tool that I use to assess dancers. So this can be used for dancers even years before they go on pointe, so they know exactly what to work on to get ready to go on pointe. It can also be used if maybe the dancer has maybe already gotten their pointe shoes, but they're feeling a little unsteady on those pointe shoes, or they just want a little bit more guidance. I've even used it with dancers that have been on pointe for a few years and they're just looking to get stronger. So it is a one-page form that looks like this. It has several different tests that we go through, and they range from ankle range of motion tests, strength tests, balance tests, core strength and neuromuscular control, and then also some alignment and ballet technique tests. So this pre-pointe screening was put together over years and years of research, and there's all sorts of research articles out there. If you're interested in those, we can get nerdy together. I can send them to you, but these were the tests that sort of showed in the research that will get your dancer ready for pointe, meaning that they feel strong, they feel stable. Once they're on those pointe shoes, they can do things rather than just kind of getting up there and being, kind of unsteady up on those pointe shoes. So there are, like I said, quite a few tests on here. It usually takes around 15 to 20 minutes to go through this screening. And this is something that will happen if your dancer is interested in taking the Pre-Pointe Bootcamp class. This is something that will happen on day one for those dancers. So they will get this Pre-Pointe screening during Pre-Pointe Bootcamp. So that is included. The four biggest tests included in this that the research kind of has proven over and over again to be effective at telling if a dancer is ready to go on pointe. Our first one is a single leg calf raise test, or heel raise test. And the dancer stands on one leg in parallel, so they don't have to be in their turnout for this, in parallel, and they rise up and down on one leg. They have to be able to maintain their heel height, so watching how high they get into that releve or heel rise position. And they have to get that 16 times cleanly on each leg to pass that. So that's really hard. Like if you try to do that, that's really challenging. So that's something that we'll look at during this screening, and then we'll focus on in Pre-Pointe Bootcamp, because calf strength, ankle strength is paramount when you're getting onto point shoes. And I hate to use the words like pass, fail. It can just sound a little bit negative. I never look at this as the dancer is failing a test or failing the screening. I look at this as where are our opportunities for improvement and how can we help this dancer get as ready as possible. So I never really say fail. Another time and time again proven test is called the airplane test. This is where the dancer stands on one leg and kind of pitches forward so that their leg is down, their body is flat, and their leg is behind them. And then they have to maintain that position and do a plie or a knee bend in that position, and they have to bend and rise 5 times. Again, they have to get 4 out of 5 of those clean, maintaining their balance, maintaining trunk control, pelvis control. So there's a lot of little nitty-gritty details that we look at in that test. Again, so that we're making sure that once they get up on those point shoes, they can control themselves on top of their leg, and they're ready to move around in space on kind of a more precarious position. Another one is called the topple test. This is a single pirouette from 4th position, landing cleanly, making sure they're not, falling out of their turns. And usually I give dancers a couple of tries on this one too, because sometimes the first time you try to do a turn when somebody's watching you, you don't do your best, right? So we do this a couple of times and we try to do it. You want to get a clean single pirouette on both sides, so that we're assessing, again, balance, also trunk control, and even some of the vestibular system. So watching how the head can turn, how the eyes can focus back up, and be ready to be on point for that. Like I said, lots more tests on this, but the 4th one that has been studied time and time again is called the single leg saute test. So that means they're standing on one leg, jumping from that one leg. They have to do 16 of those on one leg and get 8 out of 16 cleanly to pass. So that means they are jumping, being able to, they can point their toes in the air, land with their heel down, a nice soft plie, and they're getting 8 out of the 16 of those. Again, really challenging test. So these are rigorous tests to make sure the dancer is physically ready to go on point, and that's good. We want these tests rigorous because point work is rigorous. Again, a few more tests in there, but like I said, those are the 4 that have been proven over and over again in the research. So again, what can this tool help us understand? Again, it's going to help us understand if the dancer is physically ready to go on point. Is their strength where it needs to be? Is their balance where it needs to be? Is their understanding of where their body is in space where it needs to be? These are all things that we'll look at in this test. This tool can also just give us good, what we call baseline information. So maybe the dancer hasn't started any point training yet. They've been in ballet for a few years. They're like, ooh, maybe I'll go on point someday. But this screening can give us a good baseline information. So maybe we start testing them at 8 years old, with their sights on getting onto point shoes maybe by 12 or 13. And then each year we can retest and see how they're progressing. And it can also help us to know what to strengthen. So say we test early, we do the screening really early, we can go, oh, okay, we see these opportunities for strength, for balance, and we can start working on them at age 8. And then by the time the dancer has reached age 12 or 13, they've already had years under their belt working on these things. So that can be really, really helpful. And it gives us a long time to get the dancers prepared, so they're super ready and feeling really confident when they get onto pointe shoes. So making that customized program can be kind of invaluable. So like I said, on day 1 of Pre-Pointe Bootcamp, every dancer that comes to Pre-Pointe Bootcamp will have that screening done. So what we'll do is we'll have kind of everybody do the screening together. I'll be kind of watching each dancer on day 1. Pre-Pointe Bootcamp is limited to 4 dancers, so it's going to just be a small group so I can keep eyes on everyone, make it really customized. So it will be 4 dancers. It starts in July. It's over 4 weeks, and it's 1 hour per week. So it's going to be on Tuesday evenings at 5:30, starting on July 8th. So it'll be a lot of fun. Like I said, small group, so lots of individual attention. On day 1, everybody gets a pre-pointe screening. From there, I'm going to take that information and see what the dancers are what are the dancers' opportunities for improvement. And then the next 3 classes are going to be a customized strengthening program for those dancers. So we're going to take a look at what their pre-pointe screening tells us. And then I'm going to program out 3 more classes to teach them about the strength that they need, about the balance that they need. And then those dancers will go home with a home program so that they can continue working on pointe readiness exercises at home. So it's not just you do your 4 weeks and suddenly you're ready for pointe. Unfortunately, not a lot of things in our world work that quickly, but this will give dancers a really great understanding of what it takes to go on pointe shoes and how to get there. So I'm really, really excited about this Pre-Pointe Bootcamp class. The pointe readiness screen, the pre-pointe screening, if you call it that, is a proven kind of tried and true method of making sure dancers get ready for pointe shoes. Of course, with any athletic endeavor, living life on the planet, anything like that, there's no way to completely eliminate risk for injury. So I don't like to necessarily call it an injury prevention screening, but it can help us understand how to prepare the dancer as best we can to mitigate risk. So if anybody has any questions, I would love to answer any of those questions for you, and I'm excited to see your dancer, or if you're the dancer, I'm excited to see you this summer for Pre-Pointe Bootcamp, or if you want to schedule a one-on-one pre-pointe screening, I would love to see you there. Thanks, everybody. Bye.